somebody help, not just anybody help. You know,
welcome back to The Price of Business. I am your host, Kevin Price, talking to you about you and your business. Kurt Nordquist, he's here in our studios. You know him from NetSync Network. He's a regular contributor on The Price of Business. Love the stories we've got in the works, stories we're working on, and this one looks like it's going to be a great one as well, Kurt. Before you introduce our guest, though, kind of tell us a little bit about the company's story, a little bit of its history, and then segue into introducing us to your guests.
Sure, and thanks, Kevin, for having me back.
As always.
So NetSync is a Texas-based, customer-centric, end-to-end IT solutions provider. We work as consultants to design purpose-built solutions for our customers based on their business needs, and we also perform the implementations and provide ongoing support. So we work to bring with us all of the best-of-breed, big-name hardware, software companies you hear and read about every day, and really work hard as a go-to partner to help our customers get the most out of their investments.
Very good. And our guest?
Yes, so today, Kevin, we have with us on the phone Mark Darrah. Now, he's the 15-year president and CEO of a company called Athena GTX. Now, they're a biotechnology company, an innovator of trauma care products that can be included in what is now called smart medicine. The website is www.athenagtx.com. Mark, great having you with us today. If you would, tell us a little bit about yourself and what is smart medicine exactly?
Sure. Well, Mark Darrah graduated with a master's PhD in biomedical engineering out of Iowa State University, a little bit far away from Texas. But we started this company about 12 years ago, focusing in on producing wireless, mobile, patient-worn medical monitoring to assist in point-of-injury triage and treatment decisions for care providers that are in remote areas.
Very interesting. Sounds very Star Trek-ish. Sounds like something Bones would have. Anyway, I love it. And, of course, you know, a lot of the technology we enjoy today was inspired by shows like Star Trek. It's interesting. Kurt?
So, absolutely. And Texas, as you know, has no shortage of iconic figures. And as we all heard this past week, Texas lost a legend in the field of medicine. With Red Duke passing away recently, Mark, did you have any affiliation with the Light Flight program in Houston?
Oh, absolutely. My heart goes out to the family. Red was a pioneer, and we had the opportunity to work with Houston Herman hospitals on their Life Flight program recently with one of our wireless vital signs monitor. So one of the first times ever that Life Flight would go out and pick up injured patients and transport them back to the hospital, the key being time. We also gave them monitors that would translate data from the helicopter into the trauma ward upon landing. So being a pioneer, it was so wonderful to see him and operate with him and one of his colleagues, Dr. John Holcomb, there at Houston Herman. He actually came out of the military, so he knew Athena and was very instrumental in bringing our products into that platform.
Yeah, that's amazing. And, yeah, you know, and I miss his commentaries. They were a big part of, you know, our culture. Very brilliant man. Tactically, you know, first of all, I'm kind of interested in how big your company's footprint is in terms of number of hospitals and facilities you're working with.
Well, unfortunately, a lot of that is classified. We work a lot with the Special Forces, so we actually came out of that industry, and that's the black world, as you know. But we are in numerous hospitals throughout the nation, and we've recently gone not only from hospitals but into EMS and first responders, like Red Duke's program, but now into the telemedicine footprint. So as the hospitals bridge out to the extended care facilities, we're in numerous nursing homes and care facilities trying to translate that data earlier back to the care providers. So numerous throughout the nation, including Texas.
Kurt?
So, Mark, the National Trauma Institute operates out of Texas as well. Have you worked with them before?
We sure have. They were a major funding of ours. In fact, they were tied into the work at Houston Herman and at BAMC, Brooke Army Medical Center in Fort Sam there in San Antonio. So we have a very good reputation with them. Very instrumental group throughout the country, very well-known people. And again, focused on taking data from point of injury back to care providers was one of their focuses with us.
Talk a little bit about how your system, how your approach and your technology is different from the way things were before you came along. How are you a disruptor?
Sure. Well, Athena focuses really on technology that allows personnel to connect with multiple patients simultaneously. And most medical monitoring platforms are expensive and they're one-to-one. So what we do is we provide small, lightweight monitors that will connect to smartphones or devices such as miniature laptops, computers and such, which gives the care provider the opportunity to track simultaneously multiple people. So from a mass casualty incident all the way to a nursing home or a hospital, it gives the physician or the nurse the ability to look at all of their patients and run indices and warnings on all of their patients simultaneously. So it's a very unique application.
Mm-hmm. We continue to talk about wireless technology and how it really has changed the practice of medicine, as well as many other industries. What are the biggest changes, Mark, you've seen in the last decade?
Oh, my goodness. There's too many to notice, but let's just look at a couple of them. This whole turbocharged networking idea, pushing from 3G to 4G, is allowing us to push much more data and information faster than we've ever done it. It's enabled the industry to connect much better. And certainly devices, that would be my second thing. I mean, who has the same cell phone they had 5 years ago, much less 10 years ago? You remember those bricks from years ago? Well, now they're little tiny things that are really computers. They're not just phones. And then third would be probably applications. The value or the opportunity to turn a smartphone into a physiological or a medical monitor to track health. Fitbit, some of those technologies are just phenomenal. And I think, one of the things that's underrated is our ability to connect. Everyone knows about Skype, but, to be able to do online communication with high-definition video, to link a physician to a nurse that's in a remote facility or a EMT or a paramedic dealing at an accident scene, we can see not only the video of the operator but the patient.
Yeah.
And I think those are the top four in my mind.
And those are all very impressive. Mark Darrah, by the way, you can learn more about him at AthenaGTX.com. Kurt, and you can learn more about the work of Kurt Nordquist over at NetSyncNetwork.com. Wrap it up with about 30 seconds, sir.
Very good. Thank you, Kevin. Technology continues to impress me at the speed at which these advances in new products and processes that the healthcare industry is bringing to market for the benefit of all of us. At NetSync, we have a practice around a telehealth initiative very similar to what Mark was alluding to, that's bringing doctors and patients together. And for the health administration, education, you don't necessarily have to go to the doctor's office for consultations or treatment updates. You could see or talk to a doctor in Los Angeles while you live here in Houston. And now we know about Mark Darrah at Athena GTX, one more of those technologists that are the forefront of some of these incredible advances.
And we're very glad to get to know you. Thanks so much for being with us, Mark.
We appreciate it.
Kurt, great segment. When we come back, much more for you. I do want to remind you, best content here shows up over there at usadareview.com, and this is The Price of Business.